Hello, Dr. Kat Fries here from Central New Mexico Community College. In video D of the lymphatic system, we're going to start discussing the organs of the lymphatic system. And we can divide them into the primary and the secondary lymphoid organs. In this video, we're going to focus on the primary ones, and they include red bone marrow and thymus. What defines a lymphoid organ as primary is that it's the site where lymphocytes, B and T lymphocytes, are actually born and where they proliferate and continue to mature. And this includes your red bone marrow and your thymus. Notice this does not include any of the other organs that you typically think of as the lymphatic system. They are going to be considered secondary lymphoid organs. Your spleen, your nodes, your tonsils, things like that. Red bone marrow is one of our primary lymphoid organs, and it's of course a site for hematopoiesis where our formed elements are formed, our red blood cells, white blood cells, and platelets. When it comes to the B lymphocytes, they completely mature in the red bone marrow. On the other hand, our T lymphocytes, they leave as immature cells, as thymocytes, to then continue to mature in the thymus. So that's the big difference between our B cells and T cells life cycle. Make sure you know examples of locations for red bone marrow. Make sure you go look that up. It's important that you know where we find red bone marrow in the body. By the way, your patients, typically, if they need a biopsy of their red bone marrow to investigate if there's perhaps a problem with hematopoiesis, with one of the pathways within hematopoiesis, typically the red bone marrow is biopsied from the pelvic bones. The thymus is an interesting organ. It is bilobed, which doesn't make it all that interesting, but it's quite big when we're children, covering a good portion of this chest area that sits superior to the heart and covering a good portion of the heart. It atrophies as we age, so it doesn't maintain its size throughout life. Not only that, it is very specialized in its function in that it only functions in the maturation of T lymphocytes. It doesn't really allow for, I should say, the T lymphocytes, when they're still within the thymus, are not fighting off pathogens, antigens directly yet. Another difference for the thymus compared to the other lymphoid organs is that it's not made up of reticular fibers. So reticular fibers are found in the red bone marrow and in the secondary lymphoid organs, but not in the thymus. In the thymus, instead, we find these star-shaped epithelial cells and the dendritic cells that help form the stroma. And it's also these cells that then are responsible for secreting the hormones, thymosin and thymopoietin, that help with the maturation process of lymphocytes. The anatomy of the thymus is very typical for many organs. We're going to see a capsule, a fibrous capsule, probably made up of dense irregular to connective tissue. Then we have the outer layer called the cortex, and then we have the inner portion of the thymus called the medulla. You've heard these names, cortex and medulla, over and over again already. So it's in the cortex where many thymocytes are found, and epithelial cells, and a variety of other cells that can fight off pathogens such as macrophages and dendritic cells. Same with the medulla, more or less, but we see fewer thymocytes there. And before the thymocytes leave the medulla, in other words, once they're mature and, leave the thymus, they're going to move closer into the medulla. So here we have that fibrous capsule. Here we have the cortex area. And then as we go deeper, we have the medullary area right here. And just as a reminder, our thymus is quite large when we are infants, but then as adolescents and growing and as we continue to age, it atrophies to the point that hardly any of it is left when we're old.